Madam President, Madam Deputy Secretary General, Excellencies, dear colleagues and friends, it's incredible to think that just 19 weeks ago, we knew nothing of this virus. As you know, it's a new virus, and it's the first coronavirus to cause a pandemic, and it has two fatal combinations. One, it's very contagious, and second, it's a killer. That's why it's surprising many countries, by the way. Almost 4 million cases of COVID-19 have now been reported to WHO, and tragically, we have lost almost 275,000 lives. Although cases are declining in Western Europe, they are increasing in Eastern Europe, Africa, Southeast Asia, the Eastern Mediterranean, and the Americas. But within regions and within countries, we see divergent trends. That's why all countries need a tailored response. Nonetheless, there are several common things all countries must do, which are outlined in WHO's Strategic Preparedness and Response Plan. First, we call on all countries to mobilize all sectors and communities. Second, to control sporadic cases and clusters, rapidly finding and isolating all cases. Third, to suppress community transmission through infection prevention and control and physical distancing. And fourth, to reduce mortality through appropriate care, especially strengthening or preparing the health system. And fifth, to develop safe and effective vaccines and therapeutics. Research and development are essential for curbing and ending the pandemic. Since January, WHO has been working with thousands of researchers all over the world to accelerate and track vaccine development, from developing animal models to clinical trial designs and everything in between. We have also developed diagnostics that are being used all over the world, and we're coordinating a global trial on safety and efficacy of 4 therapeutics against COVID-19. The world needs these tools, and it needs them fast. Past experience has taught us that even when the tools are available, they have not been equally available to all. We cannot allow that to happen. Last month, I joined President Emmanuel Macron, President Ursula von der Leyen, Secretary General Antonio Guterres, and Melinda Gates, and others to launch the Access to COVID-19 Tools Accelerator, or the ECT Accelerator. Last week, leaders from 40 countries came together to pledge 7.4 billion euros for research and development for vaccines, diagnostics, and therapeutics. This was a powerful and inspiring demonstrations of solidarity, not only a financial support, but of a common commitment to ensure all people enjoy access to all the tools to prevent, detect, and treat COVID-19. The pandemic is teaching us many painful lessons. One of them is about the importance of strong national and subnational health systems at the foundation of global health security and universal health coverage. Strong and resilient health systems are the best defense not only against outbreaks and pandemics, but also against the multiple health threats that people around the world face every day. And yet, on current trends, more than 5 billion people will lack access to essential health services by 2030, including the ability to see a health worker, access to essential medicines, and running water in hospitals. Gaps like this don't just undermine the health of individuals, families, and communities. They also put global security and economic development at risk, as my sister Amina already said. The world spends around US 7.5 trillion on healthcare each year, almost 10% of global GDP. But the best investments are in promoting health and in preventing disease at the primary healthcare level, which will save lives and save money. Prevention is not only better than cure, it's cheaper and the smartest thing to do. The COVID-19 pandemic will eventually recede, but there can be no going back to business as usual. We cannot continue to rush to fund panic, but let preparedness go by wayside. As we work on responding to this pandemic, we must also work to lay the foundations for a healthier, safer, fairer world. And that's how we can say enough is enough and never again. So thank you so much again, and thank you for allowing me to leave. We will be starting the presser in a few minutes, but thank you for your flexibility. And Madam President, Ambassador Mona, thank you so much for your leadership. Thank you again. Thank you for this opportunity.
Thank you so much, Dr. Tedros.